This episode is brought to you by my Fertility Management Masterclass. Master fertility awareness and improve your menstrual cycle health at the same time. Head over to fertilityfriday.com/workwithme for details. That's fertilityfriday.com/workwithme. This is the Fertility Friday podcast, episode number 124. Welcome to the 124th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Now, as you know already, I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. And for those of you who are wanting to go deeper into the realm of fertility awareness charting and body literacy, I do have a number of programs that allow you to do just that. And I'm really excited to announce a brand new way to work with me. I'm now offering a one-time in-depth strategy session for those of you who are fairly confident in your charting, but still looking to gain a deeper understanding of your cycles. So for those of you who are wanting to go that extra step and get that customized interpretation of what your cycles are reflecting back to you about your overall health and fertility. And by the end of our 60-minute session together, you'll not only gain clarity and insight about your cycles and how they relate to your health history, but you're also going to leave with a plan, concrete next steps to take to improve your cycles naturally. So make sure to head over to fertilityfriday.com/workwithme to book your strategy session today. I'm so excited to share this week's podcast episode with you. This week's episode is a little bit different to the format that I usually have. So I usually interview one guest and have one in-depth interview. And in today's episode, I'm actually going to be sharing two interviews with you. And what's unique about these interviews is that I was able to do them in person. This past weekend, I attended the Restorative Medicine Conference here in Toronto, and there were a number of amazing speakers who were sharing their latest research, their latest work with patients, and what has been working for them in their clinical practice. And it was just an amazing experience to be present and to really see what some of the cutting edge, newest, latest research is in a variety of different topics. Today's episode, I'm actually focusing on thyroid health. And so the two interviews that you'll be hearing, one is from Dr. David Brownstein, and the other is from Dr. Denis Wilson. Both are medical doctors, and I'll go into a little bit more of an in-depth bio before I introduce each interview. But what was so inspiring to me was that both of these doctors are classically trained medical doctors, and what I feel makes them unique was that in their own practice, before they really delved into the work that they're doing now, what they found was that they just weren't getting the results with the patients that they were looking for. And what they had been taught about managing thyroid health, for example, it just wasn't the whole story. And so what inspired me about the conference is to really see what's possible when you are driven and determined to help your patients get better. When you have a doctor who's working with patients who's not getting the results that they're looking for, and they don't just accept that. I've worked with clients who've told me that their doctors would say, oh, well, you know, if you're taking thyroid medication and you don't feel better, some patients just don't feel better. That's a real thing. And so it's really disheartening when you hear things like that, wondering why these doctors went into medicine in the first place. Didn't they go into medicine to help people feel better? And so what was really inspiring was that you have these physicians who are really delving into the latest research, really working with their patients, really doing a lot of detailed clinical testing to find out where their patients are starting from and to find out how they're progressing with the treatment, and adjusting the treatment on an individual basis based on what's actually happening with the person, instead of believing in some sort of dogmatic one-size-fits-all approach. So it was very inspiring, very eye-opening, and I do hope that you enjoy these two interviews. They're shorter interviews. We were doing them live at the conference, and so you might notice some background noise, but that's just what comes with the territory for live interviews. And so I'll introduce the first interview. I'm interviewing Dr. David Brownstein, as I mentioned, is a board-certified family physician and one of the foremost practitioners of holistic medicine. He is the medical director of the Center for Holistic Medicine in West Bloomfield. And Dr. Brownstein has authored a number of books, two of which we'll talk about in our interview there. And he's truly a pioneer in the field of thyroid health and his protocols, specifically around iodine, around testing, and really about delving in and getting a complete view of the thyroid and actually working to help patients get better, reducing their antibody count and feeling better in a number of different ways. Like I said, very inspiring. So without further ado, I'm going to play the first interview for you with Dr. Brownstein. And just as a reminder, none of the information that we talk about on the podcast is intended as medical advice, and the best course of action is always to consult with a trained practitioner who specializes in the area that you're looking for before making any changes. So I'm here with Dr. David Brownstein at the Toronto Restorative Health Conference. So thank you so much for agreeing to take a few minutes out and be interviewed for the podcast.
Well, thank you for having me.
Most of my listeners are, well, pretty much all of my listeners are women of reproductive age. And the podcast is really informational for women to learn more about what impacts their fertility. So your approach with dealing with thyroid disorders, because you're a board certified medical doctor, and so your approach is very different than your kind of garden variety doctor. So I would love to hear about what was it that kind of shifted you in this direction?
Well, it was a long time ago, and my dad was sick. The short version, my dad was really sick with heart disease, and a patient ended up giving me a book on nutrition. And I read a couple things in there, and I tried a few things on my father, and he got better right away, and he wasn't doing well before then. And then I decided that's what I wanted to do in medicine. I just did a 180 and started studying it and gearing everything towards that, and that's how I got started.
Mm-hmm. Well, and in the first session today, you talked a lot about iodine and the relationship to thyroid. For a woman who's tuning into this and she might have been diagnosed with hypothyroid, or she is just coming on a radar that could be an issue for her, what would you want her to know about iodine?
Well, all women should know that iodine is an essential element for the body. We can't live without it. And in our modern world, in our two countries right now, most people are iodine deficient. Our food supply of iodine has gone down. Our soil iodine is very low, particularly when we live in the middle of the countries, away from the ocean. And you can't make thyroid hormone without iodine. The thyroid's integral function is it needs iodine to make thyroid hormone. So my testing between me and my partners of over 6,000 people find that over 97% are deficient in iodine, most severely deficient in iodine.
Well, and for women who have had their thyroid screened, and their TSH levels, most doctors are running a TSH, maybe a T4, a free T4, and their levels are showing normal, but maybe they're still having symptoms. From my angle as a fertility awareness educator, you can kind of see their charts look a little bit off. Maybe you could share if there's a relationship there between iodine and why perhaps they're not feeling better, even if their test is showing normal.
So the human body is designed to run okay, even if the nutrient levels aren't optimal, and it can run okay on low iodine. But there are problems that develop, and women in particular, they can develop thyroid problems like hypothyroidism or autoimmune thyroid disorder. Women can get cystic breasts or cysts on their ovaries or polycystic ovaries. All those are iodine deficiency problems. And ensuring that there's enough iodine ensures that all the glandular tissue functions normally, and that includes the thyroid, the ovaries, the uterus, the breast, the prostate, and the pancreas. And what are we having problems with right now? We're having problems with all those tissues in people. And I say the major reason we're having a problem with all those tissues is iodine deficiency.
And so maybe you could share a little bit about the specifics of it. So I know that there's a lot of conflicting information out there, and you spoke about it a little bit today in terms of if you have autoimmune thyroid, there's a lot of information that says, it's going to cause it or it's going to make it worse.
Well, it's not that conflicting. If you look at the U.S. government's own studies, iodine is needed for all those glandular tissues to function normally, and it's really important for a woman before she's pregnant to ensure that she's got enough iodine, because the growing baby is dependent on the mom having enough iodine. If the mom doesn't have enough iodine, the baby's neurologic system doesn't develop normally, and the baby's endocrine system doesn't develop normally. So my big push is to teach women of pregnancy age, they need to get their iodine, their thyroid levels straightened out before they're pregnant.
Okay, well, a lot of the women listening to the podcast right now, they have it on their mind that maybe they're not trying to get pregnant actively right now, but they may be within the next few years. How do you know if you're deficient in iodine?
Well, you can do testing, and there's urinary testing for iodine, but the vast majority are deficient in iodine because I've talked to my colleagues in Canada who are testing people. And it's not just the thyroid, it's the breast, it's the ovaries, it's the uterus. And if they're pregnant, it's a developing baby that gets affected by this. And if a woman is pregnant and deficient of iodine, that baby's IQ will not develop normally. And we don't know if that can ever be rectified even after, once the baby's born, if that can be rectified again. So it needs to be done before they're pregnant.
Well, and you mentioned cystic breasts, cystic ovaries, and, in the work I do with women, a lot of them report to have that cystic breast sensation, pain, different times of the month that might be exacerbated, but still that same kind of breast tissue. Maybe you could just elaborate a little bit more on the connection between iodine or deficiency in iodine and that.
So one of iodine's main jobs is to maintain the normal architecture of all the glands, the breast included. So if you have normal architecture, you don't have cysts, you don't have pain. And in iodine deficiency, it starts off as cysts, then it becomes hard and nodular, then it becomes hyperplastic, which is a precursor to cancer for all those tissues. And this has been shown in studies from the Soviet Union 50 years ago. And only iodine can stop this progression and rectify it.
Well, and, I'll direct my listeners to the show notes page where I'll link your book all about iodine. And could you just say the name of it?
So the book is Iodine, Why You Need It, Why You Can't Live Without It. And, it's an incredibly important element, and it's incredibly important for a person's health to make sure they have enough iodine.
And in terms of first steps, iodine is available in different options, pill form, drop form.
First step is try and work with a healthcare practitioner who's iodine knowledgeable. First step is educate yourself on iodine, then make sure your healthcare practitioner is iodine knowledgeable. If they're not, find someone who is, and they can do the right testing and get you going on it. But the old-time dosing for iodine was about 12 milligrams a day of Lugol solution, which is over-the-counter in Canada. And I have most of my patients on it, and I certainly, if a woman gets pregnant while she's on iodine, I ever continue it through the pregnancy.
Mm-hmm. Well, and to switch gears a little bit, I've done a few podcast episodes on thyroid specifically, and I find that just when I'm working with women and they're charting their cycles and we start to see different patterns with regards to thyroid, it just seems that the thyroid really messes up the endocrine system, hormones. And a lot of women struggle to either get the testing done from their physicians or even to get the proper treatment. So what advice do you have to the women listening to really get that thyroid issue addressed?
So my advice is don't put up with substandard care and don't put up with your doctor blowing you off. If your doctor's or your healthcare practitioner is blowing you off, find a new one. You're in charge of your own healthcare decisions. If you're going to put up with someone mistreating you and not giving you respect for that, then you're at fault there too. And there are healthcare practitioners you can find who will treat you with respect and look at this the way they should look at it. Educate yourself so you know what you're looking for.
So to kind of end it off, what tests are most important, or what should, when you're advocating for yourself, what do you need to know to make sure that you're talking to someone who knows what they're doing and who's going to support you?
Well, first off, the reason I write my books is to educate. I wrote those books. I've written 14 books to educate my patients. So they know what I'm doing, and they become better patients because they become more knowledgeable, and that's what you can do. And then you can ask the right questions, and you can search out, and you don't have to tolerate not feeling well, and we're not here to not feel well. We're here to feel well, and we're here to raise healthy babies and have healthy pregnancies and not be sick.
Mm-hmm. Well, and the thyroid book in particular, Overcoming Thyroid Disorder, it's one of the resources that, I'm always flipping through. I have a hypothyroid myself, and it's something that I definitely refer to women that I work with who just have questions about thyroid. So we'll link to that in the show notes page. And I just want to thank you so much for taking the time to be with me today here. I hope that you enjoyed that interview with Dr. Brownstein. You can tell that he's very passionate about his work, and he's had a lot of success with his patients. And I would really encourage you, if you're interested in what he spoke about, if you have a thyroid disorder yourself, or you think you might have, whether it's low functioning thyroid or if you think you may have hyperthyroid, I would really encourage you to head over to the show notes page, so fertilityfriday.com/124, and I'll have the links there to the books that he mentioned, Overcoming Thyroid Disorders, as well as his book Iodine, Why You Need It, Why You Can't Live Without It. Can't recommend those resources enough. Now, in the second interview, I'm speaking to Dr. Denis Wilson. So again, medical doctor who, in a similar way, was just not really seeing the results that he wanted to see in his patients. And again, what I find really interesting is that every person who goes on to specialize in a particular field obviously takes a slightly different approach. And so although the approaches that there's many differences between the approaches that Dr. Wilson and Dr. Brownstein take with regards to addressing thyroid health, ultimately there's more similarities than differences. And the end result is that their patients get better. And the strategy in terms of diagnosing patients from their perspective is very thorough, very rigorous. And so one of the takeaways that I had from attending the conference is that, a TSH test and a T4 test, which is standard fare when you go to your physician, it just is not enough. And so you have these experienced, renowned doctors who really delved into the field, really got the results from their patients. And what they're talking about is a completely different diagnostic protocol where they're not just looking at a TSH test and a T4. They're not even just looking at a full panel. So a full panel involving free T3 as well, reverse T3 and thyroid antibodies. Dr. Brownstein spent a lot of time talking about how a patient looks and how he can look at certain physical markers to determine if a person may have thyroid disorders. And both Dr. Brownstein and Dr. Wilson spent a good deal of time talking about how there are a certain percentage of patients who will have a normal thyroid test. So even though their full panel looks normal within the normal range, they may still have a low temperature, and they may have a number of other markers for thyroid. And Dr. Brownstein spoke about a number of patients who had normal tests but still had the indicators of a possible thyroid condition. And he used his experience as well as his diagnostic protocols to then determine what the best course of treatments were for those patients. So I found the whole experience to be very eye-opening, and I hope that you find it helpful. One of my key takeaways as well is that it really does matter how you feel. It really does matter what your, body temperature is, because your body temperature is that direct measure of your metabolism, and it's not in your head. There's a lot of different situations where you're potentially not feeling that well and you have all these symptoms, but your blood work is showing normal. And it's really important to recognize that it's not in your head. That's one of the things that I learned. So let's get into the interview with Dr. Wilson. Dr. Wilson is, like I said, a medical doctor, and he has developed the concept of Wilson's temperature syndrome. This is going back to 1988. So after observing people with symptoms of low thyroid and low body temperature, but who had normal blood tests, he found that by normalizing their temperatures with T3, so replacement thyroid hormone, but instead of just synthetic T4, which is typically used, Synthroid is a version of synthetic T4, he would actually normalize their temperatures with T3. So a unique approach, but he found that his patients would get better, and some of his patients would wind up not needing medication moving forward. So very, very interesting research. And I think one of the other takeaways there is that, some people do get better. Some people do end up not needing medication. Obviously not everybody, but I feel that gives some hope around that. So without further ado, I'll play the interview for you with Dr. Denis Wilson. So I'm here at the Restorative Medical Health Conference with Dr. Denis Wilson. First of all, thank you so much, Dr. Wilson, for taking a few moments to chat with me.
Thank you, Lisa. It's a pleasure.
And I really enjoyed your two-part lecture series yesterday, and I was really excited to hear all of it, but in particular, the information about thyroid and how you address that, and especially because your protocol is a little bit different, well, a lot different than the traditional thyroid health protocol. So maybe you could share a little bit about that and what led you in that direction.
Well, there's a lot of people that have a normal thyroid blood test, but they still have low body temperature. And that's crucially important because the whole purpose of the thyroid hormone system is to give you a decent metabolism. And the thyroid hormone goes into the nuclear receptors of the cells and tells the body how fast to transcribe DNA, tells the body how fast to live, and that determines the body temperature. So doctors for many years have thought that you can evaluate how well that's happening based on the blood test. But that's like trying to decide whether or not you're hungry by looking in your refrigerator. How do you know you're hungry? Well, because you're hungry. That's how you know. And you know, it doesn't matter how much food you have in your refrigerator. If you're hungry, you're hungry. So it's just like that. Because no matter what your blood test says, if your temperature's low, you have a slow metabolism, period. And that can totally affect fertility. It can affect weight, energy, migraines, depression, or whatever. And I first found out, or first looked into it or got on this track because a patient brought in a book for me to read called Hypothyroidism, the Unsuspected Illness, written by Dr. Broda Barnes, who was a real advocate for using body temperature as a way to gauge the efficacy of thyroid medicine. And he was a real advocate for T4 containing medicine. And he found, and I tried his approach in some of my patients, and lo and behold, a lot of them got not just a little bit better, but completely better using this desiccated thyroid or using this T4 containing medicine. And I was really amazed by that because that totally flew in the face of everything I was taught at medical school. But I did notice that some of my patients, you know, although some of them got reincarnated, some of them didn't, you know, and so then I was wondering, well, they still have low temperatures. Does that mean they don't have a thyroid problem, or is there maybe some other thing missing, something else I can do? So I looked at the pathways of the thyroid system, and T4 actually gets converted into T3. T4 is not the active hormone, and so it gets converted into T3. And so I wondered, well, what if they're not converting to T3 very well? So I started using T3 just to see in some of these people that I would call treatment failures. So I tried them in the people who weren't doing so well, and sure enough, their temperatures came up. Not all, but some of them, their temperatures came up and their symptoms went away. And that was amazing, but what was really unexpected is I live in Florida, and I had a lot of patients who were snowbirds, and they would go back up north. When they did and they came back, I found that they didn't need as much medicine as they did previously. And so I started experimenting with putting them on the medicine and taking them off the medicine just to see. And I found that a lot of times they were able to cycle on and off the T3, and each time their temperature held better and better till where eventually they could have a normal temperature and be off the medicine completely. So they actually reset their thyroid, their thermostat, reset their thyroid system so they didn't have to be on medicine. So if a person has normal blood tests and they have a low body temperature, not only might they have a metabolism problem, but they might have a reversible or curable metabolism problem, which is really exciting.
Mm-hmm. I think that's one of the most interesting aspects of, so what you're describing is your Wilson protocol.
Yes.
And I think that's one of the most interesting aspects of that, because it looks really complicated to the layperson. You know, you take your body temperature, and there's a lot of things involved. But ultimately, the goal and the effect is that you can potentially get off of the medication altogether and kind of have resolved the issue entirely, which is obviously not typically what we hear about the thyroid. We typically hear that it's, you know, you have it, okay, you have it for life, and that's the end of the story.
Exactly. And the T3 therapy, I mean, a lot can be done with herbs and nutrition. Some people don't even need to go on T3. They just need some support to help with the deiodinase enzyme that converts T4 to T3. If you support that correctly, then sometimes they're able to get better that way. But if they do need the T3, sometimes it's just 2 to 3 months. You know,
Wow.
And even the supplements, even the herbs and nutrients might be 4 to 6 months. Even that doesn't necessarily have to be for life either.
Well, you know, I think this is of particular interest to my listeners. So as I mentioned to you, you know, my background is in fertility awareness. So a lot of my listeners are in some process of charting their menstrual cycles. And so, you know, that involves watching for your cervical mucus observations. Some of the ladies will check their cervical position. But, you know, a big part of it is basal body temperature. And so in my line of work, you know, the temperature is right there in your face. So, for the woman who, you know, and so you see it, it's pretty obvious. You know, the charts give a decent range. And so when you see a woman and her temperatures are at the bottom of the chart, you know, that's kind of a big sign. You know, you can see immediately that they're pretty low. And so, you know, then the next logical step is to go and have a workup done. And obviously then if you're going to a, you know, regular physician, that involves a TSH and a free T4. to which, the doctor will often say it's normal. And that's a conversation on itself.
Right.
But then what would you want the woman who's listening right now, who is in that situation, to know? Like, she has lower temperatures, perhaps she isn't feeling well, perhaps she's trying to conceive and it's not happening, but her results are normal.
Okay. I would say that the number one thing that fertility doctors look at, or should look at in my mind, is the metabolism, is the temperature. That's that's low-hanging fruit. That's the first thing you want to check. And a lot of doctors know that, and so like you say, they say, oh, well, you have a fertility problem? Let's check your thyroid. And so they'll check it with the blood test, like you said. But there's a one-to-one correlation between metabolism or respiration and body temperature. It's just hand in glove. I mean, that's how you measure a person's metabolism, is with their temperature. And if hypothyroidism can give a woman trouble with fertility, a low body temperature can give a woman trouble with fertility. The only way a hypothyroidism can cause a woman to have trouble with her fertility is because it renders her a low temperature. I mean, That's the only way you get a problem, is because it's not happening the way it should. And so I've had so many times when we were able to help a woman get her temperature up and she conceived when she had tried everything else and nothing worked. I mean, it can be very hard to conceive when you don't have a normal temperature. It's a real challenge. But with a normal temperature, I mean, then at least you're in the ballpark. And so, just a quick aside, I was at and that's just happened more than once. I've had so many people introduced to me that were conceived on T3, but one in particular, I was at a medical convention and a doctor comes up and says, oh, Dr. Wilson, I'd like you to meet my daughter. And I'm like, oh, great, she's 21 years old. And he said, this is the daughter that my wife conceived when we gave her T3 therapy, and got her temperature normal. And I was like, nice to meet you. It's kind of amazing. So, so anyway, that's the thing. If a woman has a low body temperature and her blood tests are normal, then she can go to restorativemedicine.org. Restorativemedicine.org has a list of practitioners that are certified in T3 therapy, and she can find someone in her area maybe that can help her. Then those doctors are going to help her. Perhaps the first thing to try is supplements, nutrition like iodine, selenium, zinc, Google Mer, Blue Flag. These are all things that support the deiodinase enzyme, and you dose that according to temperature. So it's not like you have to wonder if it's working or helping or not. It's not like, oh, I've been trying this for a month and I'm not sure if it's helping. Well, if it's helping, your temperature is going to get higher, and so you can tell within a month if it's working. So it's like, okay, well, I'm taking this, I'm increasing the dose, and my temperature's normal, and you're good. If it's not normal, then the person might have to go to T3 therapy to get the temperature up.
It's so interesting because I feel like on the one hand, as you're talking about it, it just makes such perfect sense because your temperature is a measure of your metabolism. It's this real-time measure. But for some reason, we're so inclined to rely kind of 100% on the test. And so regardless of how you feel, if the test isn't telling you what you think it should be, then you kind of defer to the test, which is really interesting. So I love that you're talking about how important the temperature is. If we could switch gears, I did want to ask you a little bit about a different topic, which is tied into what you were talking about yesterday, and that was related to metabolism. But yesterday you were talking about weight loss, and I was just fascinated by the discussion that you were that you had about intermittent fasting and how the regulation of blood sugar, especially in relation to women who are trying to conceive, because I've had a number of guests on the show delved into PCOS, and so for the list, and some of my listeners are struggling with that, and a big component of PCOS is insulin insensitivity and that whole conversation around how to get the blood sugar down and normalized. So maybe you could just touch on how intermittent fasting protocol could have applications for women with PCOS, and especially because women who have PCOS often struggle with weight loss.
Oh, yeah, definitely. Well, just as the thyroid hormone regulates the metabolism, and testosterone regulates male health, and estrogen and progesterone regulate female health, there's a hormone called insulin that is downtown fat metabolism, or regulating fat and regulating sugar. And as soon as a person eats, their glucose level goes up from the food they eat. Whether they're eating, even if they eat fat, it's broken down into glucose and their sugar level goes up. But even if they don't, even if their sugar doesn't spike, their insulin starts to go up, because the body recognizes that it has food and it's time to burn that food for fuel. And if you've got any excess, you don't want to have too much sugar in your system, so your body produces this insulin to store the excess. So to store excess glucose and excess fat, that's in your meal that you might need later to survive if you don't have anything to eat. And so your insulin goes up, and as soon as your insulin goes up, you're in fat storage mode. That's basically what it is. You're in food burning mode and you're in fat storage mode. And so as that meal gets digested, then your insulin begins to drop. And that's a good thing, especially if you have polycystic ovarian syndrome and you have insulin resistance and you have a bunch of insulin. What you want to do is get rid of the insulin, right? So that's starting to drop. And the best way to get that to drop is to spend a period of time not eating at all, like not eating anything. I mean, you could have water, you could have tea, herbal tea, maybe some coffee or broth. You could have something like that, but you don't really want anything that has fat or protein or carbohydrate in it. And so you don't want anything. And when you do that, not only does your glucose not go up, but your insulin doesn't go up. And so you have a chance for your insulin to go down and to go way down. So you want to so there's always a balance in life. There's a time to exercise, and there's a time to rest, and there's a time to work, and there's a time to play, and there's a time to sleep, and then there's a time to be awake, and you don't want any of that to be out of balance. And it's the same thing with eating. There's a time to eat, and then there's a time to not eat. And so a lot of times, and we've heard our parents will, have told us, eat 3 meals a day, no snacking between meals. A lot of times people were told that. And maybe, parenting being a little different these days, maybe people don't hear that. But if a person's insulin starts to drop and from a meal because they're digesting it, and they start to get just a little bit hungry, and which is a sign that the insulin's going down and the glucose is going down and everything's going down. And once it goes down far enough, then your body switches over. The insulin gets low enough that you switch over into fat burning mode. You start burning your stores. Instead of storing stuff, you're unstoring stuff. And so you start unstoring your fat and you start burning your fat, which is what a lot of people want to do. It's a healthy thing to do, is to burn fat and to not carry around too much fat. So as soon as people start to get hungry, though, especially in our day and age, maybe they'll grab something really healthy like an apple. So they'll grab an apple. And it's just like, okay, this is healthy. There's not a lot of calories in this. But as soon as you grab that apple, your insulin starts to go up. You want to spend a balanced amount of time between the fed state and the non-fed state. And if you eat a little bit of something all day long, even if it's healthy, even if it's celery, even if it's, even if it's carrots, like carrots have sugar, they'll put up your insulin a little bit. So if you're grazing on these things all day long, then, your insulin's going to be up all day long. And what that means is you're going to be in fat storage mode all day long. You're not going to be in fat burning mode at all. The only time you're going to be in fat burning mode, the only time your insulin's going to go down low enough is when you're asleep.
I feel like that concept that you presented and the way that you described it with regards to switching energy sources, I felt like for me that was so, like, it just clicked. I was like, oh, that makes so much sense, because I had never thought about it that way.
Right.
And it has such incredible implications for a number of different things. Not alone, diabetes, risk, even cardiometabolic syndrome, PCOS, weight loss. But I feel like the solution that you presented is also so simple, and also kind of, again, that common sense that we've sort of lost, which often when you think of intermittent fasting, you think of the extreme, like, okay, I'm going to not eat for 2 days, or I'm going to go 18 hours without a meal. And you spoke about structuring your day around meals, where it's kind of like what you said, there's a time to eat and there's a time not to eat. So even the simple act of having breakfast and then nothing in between, and then having lunch and then nothing in between, and then having dinner, and then not eating until the next day at all.
Right.
That in and of itself can help dramatically improve your insulin stores. So maybe you could just talk about how something so simple could help so much.
Yes. And the thing that's simple is I guess the simplicity is the fed state is fat storage mode, and the non-fed state is fat burning mode. And it's not just fat burning mode, but there's also other things that happen. For centuries, anciently, people would talk about how fasting or not eating or the non-fed state could be cleansing, spiritually, physically, and rejuvenating. And a lot of people will describe the energy they feel. And I myself, as I've done this myself, it crosses your mind, you think, wow, I feel better not eating than I did eating. I feel better not eating than eating. I'm never going to eat again, because you feel so good. You're like, why was I eating all the time? And you think, oh, well, I might be sick, or I might have some kind of disease or something, or I might whatever, and I just don't feel as good as I did when I was a kid. Well, maybe when you were a kid, you spent a little bit more outside, throwing the frisbee, riding the bike, and not eating. I'm not sure, but if we spend all of our time eating, then we can be in this fat storage mode. But the simplicity is you just want to spend a little bit more time, a balanced amount of time. Because what we do, a lot of us, what we do is not balanced. It's not healthy. It's not normal. It's not the way it was, 6 to 10 centuries ago. So what you could do is, like you say, it's a very easy strategy. I'm going to have 3 meals a day, and I'm not going to eat snacks in between. That's a really good start, because if you did that, then there's a lot of time you're going to spend in the non-fed state, which is rejuvenating and awesome. Even the 2016 Nobel Prize in Medicine was awarded to a guy that explained how our bodies rejuvenate themselves. It's been shown that this rejuvenation happens especially during the non-fed state. But anyway, if someone's really imbalanced because they've been out of balance for so long and they're wanting to get back in balance, but if they're out of balance really for a long time and they do have some obesity or they do have some extra weight or central fat around their bellies and things like that, then they can counteract that by spending even more time in the non-fed state. So rather than 3 meals a day, they could maybe have 2 meals a day. They could have 2 meals a day wherever they want. They could have breakfast and lunch. They could have lunch and dinner. They could even have breakfast and dinner. If they wanted to do that, they could just do that. And then in the meantime, it's not like they can have water, they could have broth, they could have tea, and believe me, if they do that, they'll probably notice that they feel better instead of worse. And then if they really want to do a little bit more than that, they could have 1 meal a day. Maybe not all week, but maybe a couple of days a week, they'll just have 1 meal a day,
So essentially, fasting. And I feel like it's interesting. Some cultures still have that within their regular practices.
Yes.
But it's kind of like we've lost that entirely.
Yes.
And so, the health benefits that you described are so interesting, and it makes logical sense when you think about it, because it's like, well, of course your body needs to rest, and of course when you give your body that little bit of time, then it gets to do some of the things that it hasn't been able to do because it's digesting food all the time.
Right.
So to end our discussion, there's one other topic that I wanted to, and it's related to this, because basically what you described in your lecture yesterday is the reason why dieting doesn't work. And so it really kind of illustrates, it really illustrates why it is that people can eat less and not lose weight. So I feel like it's good to point out that when you're talking about this is not a restricted eating protocol where you're supposed to starve yourself. You're still eating your calories for the day. You're just eating them at certain times and just instead of all the time. So instead of eating all the time, you're eating basically the same that you would, but you're eating it either 2 meals a day or 3 meals a day or whatever the case is for you. So maybe we could end on that, because I feel like that it was so profound. How cutting calories, why the specifics as to why it doesn't help you lose weight.
Exactly. Well, as long as a person has that insulin on board, and again, the switch between storage mode and burning mode is insulin. That's the switch. So when a person is eating in the fed state, the insulin goes up and they're in the fed state and they're in fat storage mode. And when it goes down low enough, they switch fuels into the fat burning mode or the storage burning mode or the storage utilization mode. So if a person's eating all the time, then they're always in the food burning mode. They never switch over to this reserve of fuel. They never switch fuels into the stored fuel they have in the form of glycogen and fat. And so if they reduce their calories, they're actually reducing their supply of fuel because they don't have access to the other fuel. They don't have access to the stored fuel because their insulin's too high. So they're never switching fuels. They're never accessing these other fuels. They're just reducing their fuels. And when they do that, the body's forced. The body has no other option than to slow the metabolic rate, because it's just like, okay, well, this is our fuel source, and there is no other fuel source, and I can't access any other fuel source, but she's given me less, so there's nothing I can do but slow down my metabolism. And so the metabolism will slow. And when you slow, people tend to gain the weight back and then some, and they tend to stay hungry longer and not satisfied. It's just a very difficult approach. But on the other hand, when a person lets their insulin drop far enough, then in a sense they're not reducing their fuel, they're switching fuels. Because once the insulin drops far enough, they begin to access their stored fuel, which is pretty unlimited in many ways. I mean, if people have a lot of fat, then they've got a lot of fuel there. And so they're not really constrained, because then the body says, well, she's lowering my intake, but that's fine because I have all this stored fuel over here and I'll burn that. So then they get into fat burning mode.
So I really appreciate you taking the time today to share your insight on these topics. I feel like it has such incredible implications for weight loss, for women with PCOS, and anyone who is struggling in one way or another to bring down their insulin and kind of get it under control, feeling a little bit defeated because their efforts at traditional dieting haven't been successful. So this gives such a, again, like remarkably simple but just incredibly effective way of really making a difference in that process.
I agree, Lisa, and I'll just end with this one other thought, is that having extra fat is very inflaming to the body, causes inflammation. And inflammation can lead to a lot of things like hair loss, and it can also lead to infertility. So if a person can get their inflammation down, they can get their fat down. If they're not, and there's some interesting studies. There's a new article in the Scientific American, February 2017 article. It kind of suggests that sometimes when people are out of balance, they have more energy for autoimmunity, they have more energy for inflammation. So if you can get off that, then if you can get them out of that mode, then they might have, I would expect them to have much less inflammation, and that would help their fertility as well.
Mm-hmm. Incredible, the power of fasting.
Yeah, absolutely. Amazing.
Oh, well, thank you so much.
It's like the power of sleep, or the power of exercise, or the power of any other balanced thing we do. Yeah.
Well, trust me when I say I could ask you questions and bend your ear for like hours and hours, but I just want to thank you so much for taking the time this morning, Dr. Wilson.
My pleasure. Thank you, Lisa.
All right, so I hope that you enjoyed that interview with Dr. Wilson and, of course, the interview with Dr. Brownstein. It was a lot of fun to be able to interview them in person right there in real time at the conference. So, of course, the information that's presented here on this podcast, it's not meant to replace medical advice from a trained practitioner. And if anything, the takeaway that I hope that you're all taking from this is that one of the most important tools that you can have in your tool belt when you're working towards recovering or even identifying whether or not you have a thyroid disorder is enlisting the help of a trained practitioner who specializes in thyroid disorders. If you're going to a practitioner and you're asking for a full thyroid panel and that practitioner is telling you that there's no point and I don't do that and there's no reason why you would ever need to test for thyroid antibodies, it doesn't make a difference. One thing to consider is that practitioner may just not be the right practitioner for you. In order to actually address the root cause, try to find what's happening with your thyroid, even to get a proper diagnosis. From what I saw at the conference and from speaking to Dr. Wilson and Dr. Brownstein, it would really serve you. You'd be well to work with somebody who really does have a good background in thyroid disorders and who really does take more of a holistic approach, looking at you as the whole person, not solely relying on the blood work, but also actually being open to doing the blood work. And so for those of you who, if you haven't listened to the episode that I recorded, it was the first episode that I released this year with Janie Bowthorpe, who wrote the book, Stop the Thyroid Madness. That was episode number 116. So I'd encourage you to go back and have a listen to that episode if you haven't already. In that episode, I asked her, what are your recommendations and suggestions for a woman who thinks she may have a thyroid disorder, but whose doctor is unwilling to do the tests? And basically her response was, fire your doctor. Find somebody who's in your corner. Find somebody who's willing to actually take this seriously and test you. And in my personal opinion and experience, it's not really worth trying to argue with somebody or trying to convince somebody. You're not going to convince anybody of anything. If your doctor isn't willing to do the test, perhaps it's just not the right person. In the same way that I wouldn't take my car for an oil change to Baby Gap, because that's not what they offer at Baby Gap. They sell clothes. Perhaps you shouldn't take your thyroid to someone who doesn't specialize in thyroid. You would be much better served actually doing a bit of digging and researching for a practitioner who does specialize in thyroid, who can really support you. And so again, for the resources that were discussed in the podcast, head over to fertilityfriday.com/124 for more information, for links, books, websites, contacts. All those things are going to be listed there. And so I just want to thank you again for listening. If you enjoyed today's show, please do share it with a friend. You'll find the show notes page for today's episode, as I mentioned, at fertilityfriday.com/124. And if you've been enjoying for the podcast, please do look for it on iTunes and leave a 5-star review so that more people can find it. That is one of the ways that helps the podcast to get more exposure. When people are looking for a podcast to listen to, they definitely look at the reviews to see what people are saying about it. So I really appreciate those of you who've left reviews already. I can hardly believe that there's over 100 5-star reviews on the US iTunes. So thank you so much for leaving those amazing reviews. If this is your first time listening to the show, please do subscribe. I have new episodes every week, and I have a number of amazing interviews coming up. And so if you subscribe to the podcast, you'll never miss an episode. And don't forget to head over to fertilityfriday.com to join my email list. If you have an idea for a podcast episode or a guest suggestion, make sure to send me an email at info@fertilityfriday.com. I really appreciate your suggestions, and I have reached out to a number of amazing guests and had a number of amazing interviews just based on your suggestions. So do keep them coming. I definitely listen because I want to keep making shows that you're interested, and I want to make sure that you're hearing from experts in the field of fertility, authors who you want to hear more from. And if you're looking to deepen your own knowledge about fertility awareness, and you're looking for some support, understanding your cycles, getting used to charting your cycles, or even just gaining confidence in using the method, whether you're trying to conceive or whether you're wanting to be 100% confident using the method for birth control, make sure to head over to fertilityfriday.com/workwithme to learn more about the programs that I offer. So that's fertilityfriday.com/workwithme, and that's all one word. So thank you so much for hanging out with me today. I appreciate all of you for taking the time to tune into the podcast, whether you're on the go, whether you're commuting to work. I know lots of you take me for your commute, or if you're going for a jog, walking the dog, or house cleaning. Whatever you're doing, thank you so much for letting me be part of your day. And of course, as always, until next time, be well and happy charting.